Kidney stones form when minerals inside your urine crystallize inside the kidneys. Patients with kidney stones can definitely get sick. 10% of people will experience a kidney stone during their lifetime.
Kidney stones start in the kidneys, travel down the little tubes called the ureter to the bladder, and out the urethra.
Again, the larger the stone, the more likely it is to get stuck. Kidney stone pain is often described as the worst pain someone has ever experienced. Advanced treatments like lithotripsy, which breaks up a kidney stone using sound waves, or a procedure to relieve a kidney stone blockage like a stent.
Lots of water is important, but if I have fever, worsening pain, difficulty urinating, or any other worsening symptoms.
Hey everyone, welcome back. Today we'll be covering a common and incredibly painful condition, kidney stones. Kidney stones affect millions of people worldwide. In the United States alone, around 10% of people will experience a kidney stone during their lifetime. Kidney stones form when minerals inside your urine crystallize inside the kidneys. There are many causes of kidney stones, but the most common cause by far is overconcentrated urine from dehydration.
Break this down for me simply.
It all comes down to either not getting enough in or putting too much out. Not getting enough in usually means you're not drinking enough water. Caffeine, sodas, alcohol, and underlying medical conditions, on the other hand, can cause you to put too much out.
So all the good things put me at risk for kidney stones. How big are kidney stones?
Well, kidney stones can be really small, something like the size of a grain of sand, or they can be really big, something more like the size of a marble.
Will I know when I pee it out?
If it's the size of a marble, you'll definitely know. But in reality, not always. A lot of the time the stone breaks up on the way out and actually comes out in small pieces. If kidney stones stay put in the kidneys, on the other hand, they usually don't cause problems. It's when they start to migrate out of the body that problems can occur.
Is that what is called passing a kidney stone?
Exactly, passing a kidney stone. The way a kidney stone normally passes is from the kidney to the bladder through the ureter, a muscular tube that connects the kidney to the bladder, and then out through the urethra when you urinate. This is usually a very painful process.
To recap, the kidney stones start in the kidneys, travel down the little tubes called the ureter to the bladder, and out the urethra. That sounds like a pretty short journey.
Well, not always. Often the kidney stone will actually get stuck in the ureter. The muscles of the ureter spasm against the kidney stone as your body tries to push the stone out, causing even more severe pain, to the point where kidney stone pain is often described as the worst pain someone has ever experienced. I've had patients equate kidney stone pain to labor pains or even the pain from a heart attack.
What does the pain feel like?
Pain usually starts in your back or your groin, and oftentimes it's so bad it can cause you to get nauseous and vomit. The pain usually comes and goes as the ureter spasms against the stone and it inches its way out. Kidney stones can also cause urination to be very painful, and you can develop bloody urine as the kidney stone irritates the ureter as it passes. If infection goes on to develop, you can have fever, chills, and even pus in your urine. Always a bad sign.
So how do I know if I have a kidney stone?
Kidney stones can be diagnosed by a history and physical exam by your doctor, urine and blood testing, and oftentimes a CT or ultrasound to localize the stone. We look at a lot of different things on lab testing, but how well your kidneys are working and if infections are present are very important to check for.
What are you looking for on imaging?
On imaging, we check to see where the stone is located, the size of the stone, if there's surrounding infection, and if there's kidney swelling or hydronephrosis, which is when a kidney stone becomes stuck in the ureter and is unable to pass on its own. We also call these types of stones obstructing stones.
How are kidney stones treated?
The most common treatment for kidney stones may include IV fluids, pain or nausea medicine, and antibiotic medicine. Non-narcotic pain medications, including Toradol or ibuprofen, often work as well, if not better, than narcotic pain medications like oxycodone in many studies. Larger kidney stones, or those that are blocking the flow of urine, again, obstructing stones, or those that cause hydronephrosis, may require a specialist like a urologist for more advanced treatment. Urologists are surgeons specialized in the management of kidney stones, and they can determine if you need more advanced treatments like lithotripsy, which breaks up a kidney stone using sound waves, or a procedure to relieve a kidney stone blockage like a stent are indicated. Most smaller kidney stones, less than 5 millimeters in size, will actually pass on their own. Again, the larger the stone, the more likely it is to get stuck and need advanced treatment.
Just to reiterate, size matters.
Size definitely matters. It's certainly common for kidney stones to be managed outside the hospital by letting someone go home and pass a stone on their own. If patients are not admitted to the hospital for a kidney stone, they will usually be encouraged to drink plenty of water, which can help flush out the stone and avoid dehydration like we talked about. Patients may be prescribed nausea medicine or pain medicine as well. Remember, things like ibuprofen really do work well for kidney stone pain. Either way, you definitely need to follow up with your doctor.
What happens if I get worse?
Well, patients with kidney stones can definitely get sick, and things to keep an eye out for are worsening severe pain, fever, being unable to urinate, nausea and vomiting, as well as worsening blood in the urine. If this happens, patients should return to the emergency department or discuss this with their doctor immediately.
To recap, drinking lots of water is important, but if I have fever, worsening pain, difficulty urinating, or any other worsening symptoms, that is concerning and I need to see my doctor.
That's right. I'd say that sums it up pretty well. All right, everyone. That's it for our talk on kidney stones. Remember, none of the information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you're concerned about an emergency or a serious medical condition, please call 911. Keep tuning in for more information about common medical conditions, and don't forget to like and subscribe if you find our content helpful.